Hello and welcome to our video on fibromyalgia. Fibromyalgia is a chronic disorder characterized by widespread pain, fatigue, and tenderness in the muscles, joints, and other soft tissues. It affects millions of people worldwide, with the majority of sufferers being women. Despite being a common condition, fibromyalgia is often misunderstood and misdiagnosed, which can make it difficult for those living with the condition to get the help and support they need. In this video, we'll be exploring the causes, symptoms, and treatments for fibromyalgia. We'll also be sharing some tips and strategies for managing the condition and improving your quality of life. So whether you're someone who has been recently diagnosed with fibromyalgia, or you're simply interested in learning more about this condition, be sure to stick around and join us on this informative journey. Causes of fibromyalgia. The exact causes of fibromyalgia are still not fully understood, but there are several factors that may contribute to the development of the condition. Here are some of the potential causes of fibromyalgia. Number 1. Genetics. Research suggests that genetics may play a role in the development of fibromyalgia. Studies have shown that the condition tends to run in families, in first-degree relatives of people with fibromyalgia being more likely to develop the condition themselves. Some researchers believe that certain genetic variations may affect the way the body processes pain and how it responds to stress, leading to the development of fibromyalgia. However, it's important to note that genetics is just one of several factors that may contribute to the development of the condition. Other factors, such as trauma, stress, and sleep disturbances, may also play a role. Further research is needed to fully understand the complex interplay between genetics and other factors in the development of fibromyalgia. Number 2. Abnormal pain processing. Abnormal pain processing may play a key role in the development of fibromyalgia. People with fibromyalgia tend to have a heightened sensitivity to pain, which means that they may experience pain more intensely than others, even in response to minor stimuli. This may be due to changes in the way that the brain and nervous system process pain signals. In some cases, the pain processing abnormalities may be linked to imbalances in neurotransmitters or other chemical messengers in the brain. Number 3. Trauma or stress. Trauma or stress is one of the potential causes of fibromyalgia, and it is believed that physical or emotional trauma can trigger the onset of the condition in some people. Studies have found that individuals who have experienced a traumatic event, such as a car accident, surgery, or abuse, are more likely to develop fibromyalgia than those who have not. Similarly, chronic stressors like work-related stress, financial strain, or family conflict may also contribute to the development of fibromyalgia. The exact mechanisms by which trauma or stress may lead to fibromyalgia are not fully understood, but it is believed that they may affect the way the brain and nervous system process pain signals, leading to widespread pain and other symptoms associated with fibromyalgia. Number 4. Infections. There is evidence to suggest that certain viral and bacterial infections can trigger the onset of fibromyalgia. In some cases, the infection may cause a cascade of immune system responses that lead to inflammation and chronic pain. It's important to note that not everyone who contracts these infections will develop fibromyalgia, and further research is needed to fully understand the relationship between infections and the development of the condition. Number 5. Sleep disorders. Sleep disorders, such as insomnia, sleep apnea, and restless leg syndrome, have been linked to the development and worsening of fibromyalgia symptoms. People with fibromyalgia often experience disrupted sleep patterns, which can exacerbate pain, fatigue, and other symptoms associated with the condition. In turn, chronic pain and discomfort can make it difficult to fall and stay asleep, creating a cycle of sleep disturbance and fibromyalgia symptoms. Research suggests that improving sleep quality through behavioral interventions, such as cognitive behavioral therapy and sleep hygiene practices, can lead to significant reductions in fibromyalgia symptoms. Now let's discuss the symptoms of fibromyalgia. The most common symptom of fibromyalgia is widespread pain that affects the muscles and joints throughout the body. This pain can be described as aching, throbbing, or stabbing. and it may be accompanied by stiffness or tenderness in the affected areas. In addition to pain, fibromyalgia can cause a range of other symptoms. These may include fatigue, sleep disturbances, headaches, cognitive difficulties, and digestive problems. People with fibromyalgia may also experience sensitivity to light, sound, and touch, as well as mood changes such as anxiety and depression. Because the symptoms of fibromyalgia can be diverse and often overlap with other conditions, it can be difficult to diagnose. If you are experiencing symptoms of fibromyalgia, it is important to speak with your healthcare provider. They can perform a physical exam and run tests to rule out other conditions, such as arthritis or lupus. How is fibromyalgia treated? There is currently no cure for fibromyalgia, but there are a variety of treatments available to help manage the symptoms and improve quality of life. Treatment options for fibromyalgia typically focus on a combination of medication, lifestyle changes, and alternative therapies. Medications that may be prescribed for fibromyalgia include pain relievers such as acetaminophen, or nonsteroidal anti-inflammatory drugs, as well as antidepressants and anticonvulsants. These medications can help reduce pain and improve sleep, and may also help alleviate other symptoms such as anxiety and depression. In addition to medication, lifestyle changes such as regular exercise, stress reduction techniques, and a healthy diet may also help manage fibromyalgia symptoms. Exercise can be particularly beneficial for reducing pain and improving mood, and may include low-impact activities such as walking, swimming, or yoga. Alternative therapies such as acupuncture, massage, and cognitive behavioral therapy may also be helpful in managing fibromyalgia symptoms. Acupuncture and massage may help reduce pain and improve sleep, while CBT can help individuals develop coping strategies for managing pain and stress. Overall, the most effective treatment plan for fibromyalgia will vary depending on the individual and their specific symptoms. It is important to work closely with a healthcare provider to develop a personalized treatment plan that addresses your unique needs and goals. With the right combination of medication, lifestyle changes, and alternative therapies, it is possible to manage fibromyalgia symptoms and improve quality of life. What can I expect if I have fibromyalgia? You should expect to manage fibromyalgia symptoms for a long time, maybe for the rest of your life. Some people with fibromyalgia experience fewer flare-ups with milder symptoms after they find treatments that work for them. Ask your provider how often you need follow-up appointments to adjust your treatments or to adjust any medications you're taking. Fibromyalgia is a real condition that has a real impact on your life. Some days it might feel like it's all in your head, but it's not. Talk to your provider or a mental health professional if you need help managing stress and other emotional symptoms. Thank you for watching our video on fibromyalgia. We hope that you found the information useful and informative. Living with fibromyalgia can be challenging, but with the right knowledge, support, and self-care practices, managing the symptoms and improving your quality of life is possible. Suppose you or someone you know is struggling with fibromyalgia. In that case, we encourage you to seek medical advice and explore the many resources available to you, including support groups, educational materials, and lifestyle interventions. Remember, you're not alone in this journey, and there is always hope for better days ahead. Thank you again for watching, and we wish you all the best in your health and wellness journey.